Welcome back to The Daily Dish, joined now by Dr. Andrew Petersen. He is from Holtorf Medical, located there in Utah County, and we're talking today about chronic fatigue syndrome. And if this is something that you've had questions about, I'm happy you're here to answer them, because I think people have a variety of symptoms.
They do.
And they don't know what they are, and do they add up to chronic fatigue?
That's an excellent question. You know, having fatigue for a long time, there's more to it than that. If you just have fatigue, it needs to be treated, it needs to be addressed. But there are a number of symptoms that people will have: brain fog, poor memory and concentration, unrefreshing sleep. Even though they fall asleep and they sleep a long time, they're exhausted when they get up. Post-exertional malaise, which is a really fancy doctor term. What it means is you exercised or you were active, and instead of feeling rejuvenated, you feel worse. Joint pain, muscle pain, headaches, chronic sore throat, or recurrent sore throat, swollen glands, metabolism problems. There are a lot of things, and if you have those things, some of those things along with fatigue, then perhaps you have chronic fatigue syndrome.
See, when you mention those, I think everybody's had one or two of those at different times in their life. How do you know? I mean, do you need to have all of them together at the same time for it to be chronic fatigue?
No, you don't need to have all of them together. That's part of the controversy of chronic fatigue syndrome. The CDC has defined chronic fatigue syndrome as fatigue plus 4 of those things. But it waxes and wanes, and so physicians will oftentimes miss the diagnosis because patients don't complain of all of them the same visit. They say, boy, today I'm just exhausted, I sleep and I don't feel better. And so they focus on that, or they focus on the pain, they focus on, and so uniting all of that and saying, wow, there's more to this, I think that's important.
So when you have a patient that comes in and they have these symptoms, what's the test you do to know that that's what it is?
There's actually many tests, and that's the key. There's many blood tests to test for hormones, to test for chronic infections, to test for underlying mitochondrial dysfunction. That's the energy producer in each of the cells. Heavy metal toxicity, neurotoxins, coagulation defects. So there's a lot of tests that need to be done, and if they're not all done, you really won't know what the problem is. You can too often be told, oh, well, you're just tired or you're depressed.
Well, it's a doctor that needs to put that together, that needs to say, okay, look at all the symptoms. I think it could be this. Weight loss, weight gain associated with chronic fatigue?
Sure, weight gain is associated with it because the adrenal glands, the pituitary function is suffering. And when we don't make hormones like we should, then we'll have problems with our metabolism and weight gain will occur. Is
there an age that, were you going to ask that? Is there an age that it's most common?
It's a good question. It's probably most common in middle age. What seems to happen is because there's a combination of body symptoms involved. You've got your endocrine system, you've got your immune system, you've got your neurologic system. If there's a stress, so an emotional stress or a physical stress, say you got pregnant, well, that's a physical stress. That can trigger the underlying infection to cause chronic fatigue syndrome and wear out your mitochondria and your adrenal system. So middle age is very common. Now it does happen in kids. It's more rare in kids. It's actually easier to treat in kids. But the infections that we're talking about, these chronic infections like mono, Lyme disease, cytomegalovirus, and these are things that people don't really know they even have. Maybe they got mono in high school and they got better. But that infection, that virus is still in their body, and their immune system continues to combat it. And so as their immune system is weakened by some stress, that pushes them into chronic fatigue syndrome.
What's the cure for this?
Unfortunately, there is not a cure. There's a treatment. Okay. To treat the underlying infection is important. To stabilize the patient by treating their pain and their sleep disorder is important. To enhance their mitochondrial function will help. And to balance their hormones. We use bioidentical hormone therapy to do that. If you do all of those things together, then we have enormous success in treating chronic fatigue syndrome. I think one of the important things is to minimize how many medications and supplements a patient needs to take once they are feeling better, so that you can continue to avoid having a recurrence of symptoms, but not have to be on antibiotics indefinitely.
Well, we've asked Dr. Petersen just a couple questions. I'm sure you have more out there. So the best thing to do is to join him tomorrow live on your Facebook page. That's taking questions. It's a discussion. You can type in your question and they will answer it. And so that discussion's happening. And also go to holtorfmed.com That's the website, and then they can link you to the Facebook page. So
That's
it's
right.
easy to find. So tomorrow you can go and get those questions answered. Also go to our website. We'll make it easy for you, cw30.com/Daily Dish. Dr. Petersen, thank you.
Thank you.
Located
so much.
again in Provo.
It's Mom Monday, which means we're checking in the kitchen right now with Melanie Banner. Hi, Melanie. Good morning.
Good morning.
What are you going to make for us today?
I'm making coconut chia seed protein balls. They are super yummy and really good for you. I think you're going to love them.
That sounds great. That'll be coming up a little bit later on the show. But now, coming up next in your celebrity dish, did you see The Hobbit over the weekend? If so, you weren't alone. We'll give you the details on the movie's success. That's coming up next.